afternoon, everyone. My name is Navita Singh, and I'm the co-chair for GSAGH, the Graduate Student Alliance for Global Health. And essentially, GSAGH is an interdisciplinary student association to be able to connect grad students across University of Toronto, public health medicine, and just university-wide. And we also work to engage undergraduate students as well. Today, we have the pleasure of having Dr. Pennyfather. Dr. Pennyfather is a professor at the Leslie Dern Faculty of Pharmacy at the University of Toronto, and he has expertise in neuroscience, cellular biophysics, health informatics, health systems, global health, drug quality. He's published over 100 peer-reviewed articles and 3 patents. He's cross-appointed in the Departments of Physiology, Pharmacology, and Institute of Medical Sciences at U of T. And we also have Dr. Hanan Badr right here at the front here with us today, and we'll have a discussion about the healthcare system in Kuwait, local challenges and global perspectives. When Fatima and I, also a member of GSAGH, were talking about the possibility of this presentation, like I just found it very interesting. It would be a good opportunity for us here in Toronto to have sort of a different perspective of what other healthcare systems are like around the world. And I think Kuwait in and of itself is a very interesting example, and a lot of very interesting insights and perspectives can come from this discussion. So without any further ado, Dr. Pennyfather.
Thanks. So welcome, and thanks again for GSAGH for inviting us and giving us the opportunity and purchasing the coffee and donuts in the back. I realize this is Ramadan, but some of us are not fasting. The issue we're going to look at today is this idea of healthcare systems and public health. And I think Dr. Hanan El-Badr is very qualified to talk about these issues. Dr. Badr is an MD. She graduated with a Master's of Public Health from Alexandria, and she's been working in the field of public health for many years. She worked in the Ministry of Health in Kuwait, and recently she's taken up a position as the coordinator of the Masters of Public Health program in the Department of Community Medicine at the University of Kuwait. She's had a distinguished career in the public health sector, doing research at many different levels, working for WHO, for various government agencies. In addition, she set up a surveillance program, one of the first surveillance programs in Kuwait, looking at trying to detect early signals of possible future results. And this is the issue that we're going to be looking at, is how can public health systems, health systems in general, invest and recognize the value of preventative health care. Kuwait is a very interesting example in the sense that there is essentially unlimited resources. They're spending currently a relatively small percentage of GDP on healthcare, and yet they are getting, their health is deteriorating. And the issues are why. In the face of, we always talk about social determinants of health, barriers to health. What happens when there are no barriers to healthcare services? How come healthcare doesn't improve? And that's part, I think, is going to be a challenge for graduates who are interested in the global health to try to figure out what is health, what is global health, and how do we increase that. And the case of Kuwait, I think, provides a very good example. So, we'll also have afterwards, we'll have a little bit of panel discussion. Fatima Laka, as you probably know, is a graduate student in the Institute of Medical Sciences, and also a member of the GSAGH executive.
Good afternoon. Hello, everybody. Thank you, Professor Pennyfather, for this nice introduction. And I would like actually to thank Dr. Pennyfather and Mrs. Fatma for inviting me and giving me this opportunity to present this presentation today. So thank you so much on behalf of the GSAGH, all of you. Okay, so today actually I'm going to discuss the healthcare system in Kuwait. And when talking about Kuwait, I think it would be an example to the Gulf region as a whole, because it might be plus or minus very few numbers, but as an overall, it will be the same health system or the health picture in these countries. So during my presentation, I'll just a few minutes about my background and about main highlights about Kuwait, the current healthcare system in Kuwait, and what are the challenges as well as the opportunities for this system. So for me, I came from this country, the land of the pyramids. So, and I grown up there, I graduated, the pyramids are in Cairo, but actually I am from Alexandria, the second city in Egypt, or they call it the second capital of Egypt. I graduated from the Faculty of Medicine, University of Alexandria, and I continued my master's degrees and my PhD degrees, and I'm a full professor in the University of Alexandria. Alexandria is a coastal city, is a very nice city. It is a historical city as well, where you can find a lot of Roman historical places, and the well-known Alexandria Petrarca worldwide. Then after that, I moved to Kuwait, and for a lot of people who doesn't know about Kuwait, it's part of the Middle East in this area, in this small area. And when you come closer, so you can find here is Kuwait, where it is surrounded by Iraq, Saudi Arabia, Iran, and here is the Persian Gulf or the Arabian Gulf. Fine. So what about Kuwait? It's a small country. It's only around 18,000 square kilometers. Its main income of the country, more than 90% of the country income is based on oil production and exporting it. It has a small population of around 4.2. This is in June 2015. But I will come to this in a minute, because it's not all when we are talking about the population in Kuwait, it doesn't mean that they are all Kuwaitis. And this is what I'm going to explain in a second. It has a population growth rate about 1.7%. This is what I mean here, only Kuwaitis. And it has a total expenditure, as Professor Pennyfather mentioned, that it's less than 3% as a percentage of the total GDP. Although they have this small percentage of GDP, but the health indicators they are they have life expectancy at birth, which is high compared to the developed countries, which is 78 for males and 79 for females. However, the healthy life expectancy at birth, you can cut around 10 years or more out of this life expectancy. So they succeeded to add years to life, but not life to years. The total fertility rate is 2.6, which is declined dramatically than maybe 10 years ago. It was almost 5% or more, so it decreased dramatically within this short period. It has a good under 5 mortality rate, which is around 10 per 1,000 live births, and the maternal mortality ratio is around 14 per 100,000. This is some idea about the vital health indicators in Kuwait. This is what I want to talk about, which is the population in Kuwait. Although it's around 4 million, but less than 1/3 of this population is Kuwaitis. So we have only 1.3 million who are Kuwaitis, and the rest of the population is non-Kuwaitis or expatriates. The majority of them are Asians, more than half of them. Then around 40% are Arabs, and the rest from Europe or Africa, or around, they're only small percentage, around 7% only. This population, where you have a small number of Kuwaitis, which is diluted with this non-Kuwaitis, it's a changeable by time. I mean, 5 years ago, the Kuwaitis were around 34% to 35%, but having low growth rate, and they have more expatriates are coming, so become more diluted in the community. So because of that, their percentage go down to 31% only in 2015, compared to 5 years ago. So this is the population. How the health of this population is affected by the health system, this is, I will highlight it in this presentation. Again, the population pyramid of this population, you can see that more than half of them are lies between the age group between 20 to around 50 years. The males are more dominant than females as numbers, but in the younger age group, I mean among children and adolescents, it's almost the same as a ratio between males to females, almost 1-to-1. What about the current healthcare system in Kuwait? Actually, the Ministry of Health is the only it's a monopoly health system. The Ministry of Health is the main player. It is the main regulator, the owner, the operator, the financier, the provider of the services, the pharmaceuticals, the medical equipment, all are run by the Ministry of Health only. It has a very well-equipped hospitals, specialized centers, up-to-date laboratory techniques, and surgical facilities. The healthcare, as I mentioned, it is although the Ministry of Health, so 80% it comes from public service, which is covered through 15 hospitals, public hospitals, and it covers around more than 7,000 beds. For the private sector, it just covers around 20% of the services through 12 hospitals, which has around 1,000 beds. They have another part of health service, which is also offered by the Ministry of Health, which is overseas medical treatment. And this is paid by the government to only Kuwaiti nationals. So, for example, in 2013, there were around 2,500 Kuwaitis who went abroad for treatment, and this has cost the country more than $700 million during this year. So the ministry is covering all of this budget. For the manpower working on this health sector, the majority are expatriates of non-Kuwaitis. So as you see, either in the governmental sector or the private sector, the majority are expatriates, especially among the nurses when it comes to almost work by non-Kuwaitis from different nationalities. For the services provided, as we mentioned, it is just by the Ministry of Health. So it provides the service through the primary, secondary, and the tertiary healthcare centers. But more than this, that there is another part, which is the insurance. And when I talk about insurance here, it's only for non-Kuwaitis. There is no insurance for Kuwaiti population. They are offered all the health services for free. Either surgeries, pharmaceuticals, checkups, all the health services are provided to them for free. But insurance here is for non-Kuwaitis only, or for expatriates who are present there for working issue and their families. How this is working, I'm going to explain it a little bit. So the target of this insurance, it has a very good items as a target. So it has a good intention to provide high quality of medical service, to provide healthcare facilities of good qualities on all the levels, to have efficient medication to be introduced. So actually the intention of this system was good. But is it working with this intention? This is what I'm going to discuss. First of all, the population pyramid of the expats is like that. So the majority of them, but the majority are males, then more than females, because definitely because they are there for working conditions and they are with their families. But the majority, as you see, is in between the age group between 20 to almost 55. Those who are old age are very few percentage, and the younger age group, who are the children accompanying the families, are small percent. So we are talking about almost the age of healthy population, between 20 to 50 or 55. So these people, which is, let us say, around the 3 millions out of these 4 millions, these are the people who are paying for insurance to get the health service for them to be provided. So to have this health service provided, what is the hierarchy of receiving this health service? So let us, for example, if someone got sick, so what is the hierarchy? He has first to go to the primary health care center for checkup. So either he has a complete medical service or incomplete. If it is incomplete, cannot be solved at this level, they will be referred to a higher level, which is the governmental hospitals, where he will be served either as outpatient or inpatient to get continued for his service. Then there should be some investigation, either laboratory or radiological, and an intervention at the end as a medication or surgical procedure. So this is for any person, but I will focus here on the expat, the people who pay the insurance. So this insurance is incomplete. They are not paying this insurance, so they are provided all this service for free. No. At each step of these levels, they are paying. Okay, although it's a little amount of money, but again, it is money. And we have to look to think about not for professionals who are working as physicians or doctors or pharmacists there. No, I'm looking for those who are working as porters, as drivers, as maids. So this little amount of money, it really counts from their income. So they have to pay at the primary health care center. When he has to go, he has to pay a small amount. If he got the service, if he has to be referred, he go to the governmental service. If he is inpatient, he doesn't pay for the surgery, for example, or for this, but he has to pay for the bed. For the bed, he has to pay around $20 a day per night. If it is in a special room, so this makes it $40 per night. But for the service, he's getting it with no payment. To the level of investigation, again, he has to pay. For any laboratory investigation, he has to pay money, especially if it is, and there is no universal price for this. Definitely, it depends on the type of the experiment or the type of the analysis that he's looking for. For example, to check for vitamin D, you have to pay around $100 to do your checkup for your level of vitamin D. For radiological examination, it's not different. Only the X-ray, he can get it for free, but any MRI or CT or any advanced level of investigation, he has to pay for it. And here we are talking about big money. For MRI, for example, it's around $800 to be paid to make the MRI. The CT is much higher than this. Again, another point, when it comes to medication, he has to pay for the medication, and there is some regulation in Kuwait that not all the medication is universally provided to everybody. There are some restrictions for some medication to be prescribed only for nationals or for Kuwaitis, and equivalent ones or less efficient ones to be prescribed for non-Kuwaitis or expatriates. Okay, so they are paying for it, and even they don't get the same level of efficiency as a matter of treatment. So as you see, it is incomplete insurance. They pay the insurance annually, and this is a must. It's not an option for renewal their residency in the country. So it is connected with their residency. So they have to pay the insurance. But as long as it is incomplete, so they have to pay at each level of service in the health to get the health service provided. Okay, for all of this, and although the Kuwaitis are just less than 1/3, and we are talking about expats at 3 million versus 1 million, this is the healthcare load of expats in the Ministry of Health. For example, in 2013, so this is how they are using the service, because it is with some restriction, with some payment, and although they are the majority, but their using for the health system is much less than Kuwaiti nationals, who are just 1 million there. Why? It might be because it is offered for free for them, so they are getting the service either needed or not needed in many cases, and some restriction for the expats to use it. So because of this, they don't use it a lot, except if it is really a case where it necessitates certain intervention. So for all of this, what about the Ministry of Health budget? To budget this service or this healthcare service, and here what I mean by budget is the healthcare services only, either preventive or curative. It has nothing to do with infrastructure. So over the years, as this figure shows, that it is here from 95 to 2013. As you see, there is a steady increase in the Ministry of Health budget, that it started from around 253 million up to here it's around, you cannot, okay, so by Canadian dollars, here it's around 5,000, so we are talking about $5 billion in 2013. This budget, actually, when you calculate it, you find that this budget is meant to be spent on the nationals only, because what the government gained from expats as insurance money, it can cover expats and with excess also to be added to the budget of the Ministry of Health. So this budget, or this 5 billion, it ranges around how much from the total government budget. Again, over the same period of years, you can find that it usually fluctuates between 6 to 7% of the total government budget. This is the budget for the Ministry of Health. What about the per capita health expenditure? So this amount is, and here what I mean by per capita, I mean fair for only nationals, for Kuwaiti people. So as you see here, among the same period of time, it was around $500 per person, and increased up to around $1,200. So with this too much income, with this affluent country, one of the highest worldwide income country per capita income, so they have this just expenditure on health per capita around $1,200 per year. If we compare this health expenditure as percentage of the GDP in 3 countries, I just took here Kuwait compared to Canada, and I just took Egypt as one of the Middle East countries. Okay, so you can compare how much percent Kuwait is too much less compared to Canada or even Egypt. Okay, and although the per capita is much less than this spent in Canada. So this tells something that there is no much investment in health. So the health there is just for providing the service, mainly for curative, because the preventive is very little spent on preventive in terms of vaccination and some programs which is not that efficient actually. So what are the challenges for this healthcare system? Actually, the burden of the non-communicable diseases, it is mentioned by the WHO that all the Gulf region by 2020, they will have around 60% of the burden of the disease is due to NCDs. So this is one of the main problems that is challenging the country and challenging the healthcare system is the increasing number of NCDs in the country through actually coronaries or cancers, diabetes, hypertension. Many NCDs are present there, and it is increasing and on annual basis. It's not decreasing. The other thing about from this NCDs, this is the proportional mortality in 2014 in Kuwait. As you can see that around 73% of total deaths is due to NCDs, unfortunately. So NCDs actually is a big and the first challenge for the health system in this country. Another problem, and I think it is the origin of all the NCDs, which is overweight and obesity among the population there. So this is an estimation of the overweight and obesity in 2013. So you can find that just 23%, less than 1/4 of the population who are enjoying normal BMI. And this is all the adults, I mean 20 plus. But when you come in other studies, when you come to certain age groups, when you come older, I mean 40 plus or 50 plus, I did one study among national-based study, it was among 50 plus of the population. So the overweight and the obesity was around 81%. So it's coming much lesser the people who are enjoying normal weight. And this is actually the origin of the next NCD. So this is the beginning, or this is the start. So the obesity is followed by hypertension, diabetes, cancers. It is actually determined to many NCDs, and it is now classified by the WHO as a disease, not only just an overweight. So this is one of the main problems today. It's not only actually among adults, even among children. So among adolescents, again, you have the overweight and the obesity starting from very young age. And younger than this age group, 13 to 15, even many studies are done among 5 to 6 years old, and we have similar pictures. The obesity among boys in this age is much more than among girls, but you are talking here about almost half of the girls in this age group, and here only 40% of them who are enjoying normal weight. So this is in the age group of adolescents, so definitely it is expected by getting older and reaching adult age, they will be suffering from a severe obesity states. Again, for diabetes, for example, Kuwait ranks the fifth up in the top 10 countries who have diabetes worldwide. So, although it is it is a small country, but it is challenging the world in one of the highest rank of diabetes. It's interesting here to find that among the top 6 countries out of the 10, 5 of them are Gulf area. And this can emphasize what I mentioned at the beginning, is Kuwait is just example to the Gulf region, where the same health problems, the same health system is present everywhere. Another health problem, which is in Kuwait, is physical inactivity. Physical inactivity is defined by the WHO as the 4th risk factor for cardiovascular diseases. In Kuwait, we never talk about physical activity anymore. We talk about physical inactivity. So this is in study among the same population who are adolescents, young age, which is expected to be very active age group. It's interesting to find that among boys and girls, you have an inactivity almost more than 3/4 of them, or interesting, 90% of the females are physically inactive. Another problem, which is tobacco, which is well known as a risk factor for 6 out of the 8 leading causes of death worldwide. What about Kuwait, the prevalence of tobacco use there? Unfortunately, more than 1/3 of the population of adults are smokers, and among adolescents, more than 1/4 of them are smokers. So there is a very high rate of smoking in this country. Another challenge for this health system is the prevalence of seniors in Kuwait. Okay, so as we mentioned, they succeeded to have one of the high life expectancy, reaching almost 80 years. This is very good achievement, but it is estimated that right now they account with around 5% of the population. It is estimated by 2030, this number will be double, almost double. They will reach almost 8%. And by 2050, they will reach 25% of the population. So the question here is the healthcare system or the Ministry of Health in Kuwait is ready in less than, or let us say in the coming 2 decades, to face 1/4 of the population with this age group, and with this more than 60% of them having the problems with NCDs. This is a very big question mark is facing the healthcare system in Kuwait. So it's not all challenges, but sure there should be some opportunities for this country. One of the important opportunity is it is a small country. A small country, it's very easy to do surveillance. It's very easy to implement the programs. It's very easy to do studies and to work with the people in different age groups. So actually, it's a privilege that you have a small country. It's difficult to have a national-based studies anywhere if you are in a big country. But in Kuwait, it's very easy to do a national-based study because it is a small country, small population. You just have to do a good sample and you have the data of the whole country in one study. So it should be used as an opportunity. The other thing, they are affluent country. They have the finance, they have the resources, they have everything available. But how they are spending this money? They have good infrastructure, but they can do more services, and they can use the international exchange of experiences, which unfortunately it is done on a very limited scale. So they can use the resources to have better chance for improving the health system there. One of the opportunities that it is mentioned by the Ministry of Health in 2012, that they are putting 4.4 billion for expanding 9 public hospitals. They are aiming to introduce more or around 5,000 beds extra, and an extra 150 operation rooms, and around 500 outpatient clinics. So they have very good opportunity to have better service. Another opportunity, they have a plan for a public health agency. And this is one of the weak points in Kuwait up till now. But the plan is there, it's not implemented yet, but they are looking for having a public health agency. Because we are working there doing a lot of research, and we have the numbers, we have the evidence, but we don't know where to go with these numbers. Whom to guide, or who have the authority to do any intervention in the community. So whatever actions are done there are on individual basis. Someone who can have some connections can do some intervention, and it can continue, or if he can succeed to make it sustainable or not to be sustainable. So this is actually, the country is lacking this agency, and I hope that it is implemented soon. Another opportunity that the healthcare policy shouldn't focus only on finance. They have the finance, but there should be, or they should start to think about providing sustainable equal health coverage. And I mean here by equal health coverage to all population of Kuwait, to have the same health service, to have the same opportunity to access the services available in the country. There should be insurance for nationals. It's not a matter that they have enough money, but the enough money, yes, you are providing the service, but insurance also, it has to do more than this. Like, for example, it can restrict the overuse of service when there is insurance for these nationals. Because many of the health systems, there are actually more usage or extra usage, or to some extent, I don't want to say abuse of the system, but there are extra usage of the health system because it's free of anything to be there. Other thing also is to have community involvement, community awareness and participation in the decision making, or in the including all the people who are residing in Kuwait to have an opinion, or to have something to do, or to have their perspective, or in the health system, or in the health services provided to them. They should be involved as stakeholders of this system. This is some of the expansion project. As you see, they are planning for very fancy buildings and very well equipped ones. So actually they can have to use these opportunities to have better health status for the people living in Kuwait. But the point here is that change is by building new hospitals, having more beds. So if we have more NCDs, so are we providing more beds and more medication? If this is the solution, actually from the public health point of view, I can see it in this way. Yes, we have high incidence and prevalence of NCDs, which definitely will lead to high rate of hospitalization and the demand on the healthcare, demand and the burden on the healthcare. But what about the prevention and health promotion? Very little is invested in this area. Actually, prevention is marginal service there, except for vaccination. They have very good vaccination coverage, up more than 96 to 97% vaccination coverage. But what are other areas of prevention? I mean, the lifestyle or the living condition for the population who are living there. So actually, I can say that the pyramid is upside down, and if they are really looking for improving the service and improving the health status of the people, especially for the challenges that Kuwait is facing, it should be in this way, that the main budget or the main effort should be shifted to health promotion and prevention. I'm not underestimating the curative effort, but there should be a parallel effort and load on the prevention and health promotion, because this automatically will make a decrease in the incidence and the prevalence of the NCDs, and automatically will be decrease of the load on the health system. So it's a prevention versus curative. So the resources should shift from the curative to the prevention part. This concept should be changed if they really are looking for improvement of the health status and the health system. One of the activities that I have done, I worked in the Ministry of Health for some time before I moved to Kuwait University. So I developed a protocol for early detection clinics. This early detection clinics, all the target of it is to promote and to prevent, to make a checkup for the person on annual basis, so where you can early detect any problems, to have services for promoting the lifestyle, to have a weight monitoring, to have a monitoring for all the vital measures of the body, as blood pressure, as heart rate, as ECGs, as some screening tests at different age groups, so where we can detect early any health problem and where it can be easily controlled at that time. I succeeded to create 5 clinics, as Kuwait geography is divided to 6 areas. So we created 1 clinic in 5 areas, so we have 5 clinics. But again, the awareness of the people should be there, because this clinics is aiming the apparently healthy people who don't suffer from any health problem, but they have to go there to have their regular checkups and to know if they are following a healthy lifestyle or they have to promote another healthy lifestyle. So a lot of services are there, but it's still in the very early steps, because it's just almost, I think, 2 years ago, this started this clinics. So its effect is not yet present. And again, the attendance of these clinics are not that much, because as I mentioned, the awareness of the people, it needs to be emphasized on the importance of such clinics. So the effort is there, and there is a lot to be done, but I agree with Dr. Margaret Chan that we can turn the tide, but we have a long way to go. Thank you.
So thank you, Dr. It's getting a little late, but so why don't we just, we were going to have a little bit of a panel discussion, but I think we'll just open it up for discussions. But maybe I'll just start. I guess one of the issues of the long way to go is that you get the impression from what you described that there's a lack of imagination about what is healthcare. People don't really make an effort to eat healthy or exercise or engage in activities. Perhaps it's because of the weather, perhaps it's because of the cultural aspects. But how do you think that these cultural orientations to health can be changed from a preventative perspective?
Well, I agree with your point that it's one of the main problems, that lack of awareness among the population. And I think it can work on parallel level, on different levels. Schools are the main part where we can start from the young age, where education should be there, increasing awareness, practical exercises where they can live healthy and to understand, to read the nutritional facts on the food, how to select their food. Mm-hmm. Actually, this should be start from there. And on all levels of education, through schools and even universities, and it can be campaigns for the public, in workplaces, in general places, in malls, in anything. So we can do some effort, and actually there are some actions happens, but it's sporadic. I mean, there is no plan for maybe after the public health agency is implemented, there might be certain plan for sustainability of some programs or keeping it going on.
But I guess along the lines of the schools, even if there is physical education periods, I guess a lot of students skip it. They don't participate in physical education.
Unfortunately, the PE classes or the physical education classes in most of the schools, it's twice a week. And for many of the students, it's an opportunity for the class where it's a recreational class or they don't take it seriously. Although it is recommended in this age group that they should be active every day, at least for 1 hour.
Okay, well, anyone from the audience? Yes, over there.
Hi, Dr. Badr. That was really fascinating. I have a lot of questions, but I guess one of the things that kept popping up is this different dimension you have between Kuwait the national health insurance is financed, is that just from the government taxation or just their revenues, or is that financed by the private insurance from non-national? Or is there something else?
Okay, thank you for this question, because actually it's one of the main parts that affecting the healthcare system in Kuwait. For nationals, actually there is no insurance, okay,
Right.
and there is no tax system in Kuwait. We don't pay taxes,
Right.
so it's all coming from the government.
But the government gets its money from
From oil.
From
oil.
right, because they also are.
Yeah. So all the, as I mentioned, it's more than 90% of the income of this country is coming from the oil. Okay, so the government is paying everything, even their overseas treatment.
Right. So yeah, where we spend like 40% of Ontario on healthcare, so it's fascinating to see that 6% of the government budget, and you guys will have great healthcare.
Well, that's the issue. Is it great healthcare?
Right. So that's the question. So I'm actually curious about the divide between the Kuwaitis and non-Kuwaitis. So there seems to be a lot of non-Kuwaiti professionals, health professionals as well.
Right.
Is there a divide perhaps in that population as well? Do they get paid similar wages, or is there differences between Kuwaiti health professionals versus expats? And for the non-Kuwaitis, is there a way for them to